Hi everyone and welcome to Osamu Rat Care. So today's video is on a fairly timely kind of topic at the moment, which is all about zoonotics. Now for those of you that don't know what zoonotics are basically when a kind of disease, a virus, etc. travels from one species of animal to another, and in this case, generally speaking, from kind of an animal to a human. And this is particularly timely, obviously, because for those of you who are watching it right now, COVID-19 is causing chaos to the world. But it's also something that is relevant to us regardless of whether kind of like right here and now, and in several years' time there will still be zoonotics around. There are many different zoonotics that can kind of pass from animals to humans, and actually COVID-19 has now gone beyond that. It's now passing from human to human, so that's kind of a different thing. But one of the things that I'm seeing coming up a lot on kind of Facebook groups, etc., is whether rats can catch COVID-19. So I thought it'd be quite useful for us to kind of have a go through what zoonotics rats can catch from us, and vice versa, what we can catch from rats, and at least the major ones. Where are you off to? Yeah, at least the major ones. There will be others that I won't mention, and I will say as well, this will be mostly UK centric, so I'll be talking about the things that kind of common in the UK. But what I will say is they tend to be fairly common in most of the world, particularly kind of within Europe, America. As you're getting further out, there may be kind of different issues, but I suspect some of these will still be common. Right, so first off, on topic, COVID-19. Can my rats get it from me? Should I get it? Luckily, I don't have a cough at the moment. We shall see how things go. And the answer to that one is currently no. So COVID-19 is a particular kind of virus, coronavirus. Interestingly, rats have their own version of a coronavirus, but it's completely different. And it's passed originally from bats, and then some humans caught it, and then it developed human-to-human transmission. So currently there is no evidence that it can travel from humans to rats. There's been, I think, all of 1 or 2 cases of it potentially being carried on an animal, in case of dog. But I will say it could be carried on any surface at the moment if something is around it long enough. But there is no evidence of it actually infecting another animal other than us humans and the original host, the bat. And it is very unlikely for that to happen. So as much as this virus is mutating quite quickly and doing lots of interesting things that are not necessarily good, it's not, if it's going to mutate enough to jump to another species, there is no guarantee it'll be a rat. In fact, it's just as likely to be, I don't know, a dolphin or something like that. It's something that I wouldn't kind of worry about or dwell on at the moment. Just focus on the kind of really important things around the virus, which is to stay safe and look after yourself and other people, and make sure, should you do fall ill or anything kind of come up with you, make sure your rats are looked after. So what I have on all my cages, you may have seen it before, let's steal food, is something that lists what rats are in each cage and how much to feed them. So if I do fall ill and I can't look after them, my husband will know what to do. And actually also there's various people that are contact lists that he can go and contact. So that's the kind of like right here and now thing over with. I'm going to talk about actual zoonotics that you can pass to the rats and the rats can pass to you. So let's start off with some of the ones that people mostly have heard of. So first one that people often associate with rats is Leptospirosis, or Weil's disease. So sometimes people might call it Weil's disease. I'm not entirely sure how the best way to pronounce it is, but effectively this is something that's in basically carried in wild rats' urine. Doesn't really bother them, they're fine with it, it's not causing them any problems. But if it gets into humans, either from swallowing it, getting through cuts, that kind of thing, then it can cause us to become very ill. Kind of flu-like symptoms, quite unpleasant. It's something that you need to be very, very cautious of when you're going out and doing things in the water, outside, in the kind of countryside. But it's something that is incredibly rare in pet rats. And the reason is that basically it can be cleared up via of course a doxycycline or something like that, you know, kind of proper antibiotic treatment. Assuming that it's active in the rats, that will wipe it out straight away. And actually it's not even active in all wild rats. It's in some of them. We don't know exactly how many. Testing only picks it up when it's actually active and it goes through a dormant and active phase. But again, the rat is not ill with it. but it is incredibly uncommon in pet rats. It's something that you'd rarely ever come across, and in reality they would have to have spent some time outside or lived with rats that spent time outside. So it's something, should you come across, let's say, a pet rat that's been running around outside for a period of time, your rat escape, and then you find it again, it's something you should definitely treat for, because it can make humans very, very sick. You should always do it as a precaution from any rat coming in the wild. But it isn't something that in itself is something to worry about. Let's say you get a rat from a nice breeder or a rescue, it's very, very unlikely that this will be an issue. So that one's quite important. Again, does not bother the rat, does bother us humans, very uncommon in pet rats. So the next one that is also commonly makes the news is rat bite fever. Foo is a little bit bored of being with her kittens at the moment. She thinks they're sweet now and again, but she'd like her freedom. But yes, so rat bite fever. So this is something that comes typically from the bite of a rat, but it could in theory kind of come along in other ways if you kind of got that really close contact with it. Now, you do very, very rarely hear about this happening in pet rats. It is not common at all. If your pet rat bites you, it is highly unlikely to cause anything like rat bite fever, because the majority of them do not carry it. You hear about the odd case, but it's quite often where the animal has spent time outside again, or somebody has not been kind of particularly careful when they have been taking other animals from outside. But yes, it is incredibly rare in the pet rat population. In fact, in my years keeping rats, I've never known anybody personally affected by it. And we've all been bitten by the odd rat occasionally. It's one of those things that kind of comes with any length of time of rat ownership. Even if you've got absolutely lovely rats, stuff could happen. Get like your food. So yes, so it's something that could happen. Again, bitten by a rat, kind of feverish symptoms. Make sure that the doctors treating you know about it, but it's far more likely if you do get bitten by a rat that it's probably just going to get, well, normally it's absolutely fine, but occasionally it gets infected and needs treatment. And I'm not talking about your little kind of like nibbles and mistakes, it's the ones that really break the skin. You have to keep an eye on, and it can be worth getting antibiotics, but that's not for rat bite fever. That is mostly because they get an infected wound, and they do tend to puncture quite deeply when they do happen. I should probably do a kind of video on bites at some point. But anyway, so that's another common one. So then we come on to the next set. I'll come back to that one later. Come on to the next set of things, which are things that we can pass back and forwards from kind of rats to humans, and back and vice versa. So there's two things. They're kind of skin conditions, infections I will call them. One's a bacterial infection called staph, sometimes known as rat keeper's finger, because it is quite common in rat owners. Though I will say I've had staph twice. It's not come from my rats, it's come from horsefly bites, and I think another one was a spider bite. Absolute bastard, horrible stuff, really, really itchy. I have no idea what they're up to. That's always a bit dangerous feeling. Yes, so staph infection, how it shows up on humans is you see it as kind of like little blisters on the skin. Very, very itchy. You itch it and those blisters start to weep, and then it spreads and you get more blisters, and it's horrible. And it's something that you need to treat. It's not something that will go away on its own. A couple ways to treat it. Hibby scrub is very good, so I quite often have it in for the rats. You want to dilute it slightly, kind of clean the area at least twice a day, and make sure that you don't scratch it. When you scratch it, you help it spread. And you need to be very careful with anything that touches that area, particularly your rats, because you can spread it to your rats, and as they can spread it to you. So it's kind of like a mutual share the staph infection type situation. Another thing that's quite good for treating it, and actually the one I prefer, tea tree oil, the kind of like the stuff you'd get from a health food shop, not kind of in a cream or something. Use that diluted, about 1 to 10, and just clean the area again twice a day. It stinks, it's not particularly pleasant, but it seems to work very, very quickly, a bit quicker than hibby scrub in my experience. I will say both of those can also be used on rats. So when you see staph in rats, what tends to happen is you have kind of a bald patch, and the skin kind of gets reddish, inflamed, quite often gets scabby and quite manky, and then can get oozy. It's quite unpleasant for them as well, really itchy, really unpleasant. So again, you wash twice a day with hibby scrub, dilute hibby scrub, or dilute tea tree oil. If that's not clearing it up, either on humans or rats, they quite often need another kind of antibiotic treatment, something like Coamox, which is Sinulux, clavaceptin, nizomox, amoxicillin, penicillin if you're a human. That will help clear it up and it's quite effective. And you can also get some creams that contain the similar kind of active ingredients. That's my ear, you're eating, little monster. But yes, so that's one to kind of bear in mind. Next one, ringworm. Ringworm's very similar. It's a fungal infection rather than a bacterial infection. But again, we can pass it to rats and rats can pass it to us. So we should always, if we've got a ringworm outbreak, we should make sure the rats are protected from it. We kind of cover up. Ringworm's a stubborn bastard too. So the kind of spores from it can live for a very long period of time. So if, let's say, you have it and you need to make sure that you get something that's particularly good for cleaning up ringworm afterwards when you're kind of touching areas. Keep away from the rats or anything that could touch the rats. And if the rats have it, same thing, you need to clean up really carefully after them. There are some disinfectants that are particularly effective against ringworm and there are many that are not. On humans, ringworm will show up as kind of like a pinkish ring, hence its name, a patch of kind of skin, and it will be very, very itchy. It's not going to have the blisters of staph. But it is quite kind of ringy. You'll see pictures if you Google it, to be fair. On rats, it shows as kind of bald patches typically, and those are quite round in kind of diameter, and they can turn into rings too, but it doesn't have the same kind of ooziness as you see in staph. But if you're not really sure what it is, then it's always worth getting a skin scraping. So the vets will take a little kind of bit off the skin, get it put under the microscope, have a look, or send it off to the lab so they can have a look. What I have seen a couple of times with ringworm in rats is cases where the rat kind of basically gets really thin fur until they can see through it and it's all over their body, and then it actually gets kind of quite red and inflamed and like sore looking as well. No idea what Foo's up to. She's trying to kind of get some food. She's clearly starving. There you go, miss. Right, distracted Foo for a bit. So that's the thing to look out for ringworms in rats and ringworms in humans. And again, it's kind of touch propagated, though it seems to need some sort of kind of wound in the skin in order for it to get in. So you might have like a rat with ringworm for a period of time and its cage mates are fine, and then you might get an outbreak in that, but it is quite tough, very difficult to kind of clean up. I would say if you've got more than one group of rats, try and keep it isolated to that group of rats, so don't free range in the same area, or if you do, clean that area down fully afterwards. It's quite important. And again, make sure you kind of like washing your hands and such between it, especially if you've got it yourself, so you don't pass it to the rats. It's all about a bit common sense, really. So the one I decided to leave till last, the other kind of reasonably common one, and this is one that I do think people don't understand particularly well and don't realise is a risk, but is a real risk, and that is Hantavirus. So for those of you who've heard what Hantavirus is, you'll probably now be shitting yourself because you've heard about the kind of Hantavirus that makes people very, very ill very, very quickly and does kill. And I will say that the Hantavirus we're talking about with rats is the Seoul strain, so not all Hantavirus is the same. And this one is not as bad as the one people tend to hear about in the news, but it is one that can cause problems. So for the majority of people, or actually I should say first, it is believed that the majority of rats in the UK at least, and probably Europe, and there is also evidence that there are rats in America with Seoul Hantavirus, and it is believed probably in the UK that the bulk of rats probably carry it, and it's something that they only shed some of the time. So you come across people that are testing the rats, it could be blood tests, can be urine tests, etc., and they don't always shed it, so it's quite unreliable testing for it. You may, if you've tested enough rats, you probably pick up the one or two that will carry it, but it's probably safer to assume that your rats probably do, at least in the UK, where there was some testing done a few years ago with the help from the NFRS and the rest of the fancy, which showed that the majority of kind of like showgoers had been exposed to Hantavirus at some point in their life. So in humans it's a much more accurate test because they test for antibodies in us, and if we've got the antibodies then we've been exposed to it at some point. Sadly I missed out on that testing, which was very annoying. I think I missed the one show where I could go along and get tested, but I fully believe that I've been exposed to it at some point in my life and no doubt suffer from it. In fact, I remember a really nasty bit of flu when I was a kid. I do wonder if it was that, because we have had rats for a long time. But anyway, so what you see when you're affected by Hantavirus is its flu-like symptoms. It's funny how a lot of these things end up being flu-like symptoms, but that's because it's kind of you tend to get a fever with flu, you tend to feel shit, and that is something that tends to happen with various different illnesses. So if you get flu-like symptoms as a rat owner, particularly if there's kidney involvement, you need to make sure that the doctor knows to test you for hantavirus. It could well not be that. Like I say, there's lots of other things like flu that can cause flu-like symptoms, and actually also now the world we're living in at the moment, coronavirus to an extent as well. But it is worth mentioning to them that you have pet rats. For the majority of people, it's not going to be worse than a bit of flu, heavy cold, unpleasant, and then that's it, and they've had it for their life and they'll never get it again. For a small number of people, it can be serious. So the reason this kind of all came to light, and it was quite a few years ago in the UK rat fancy, was a lady who was a breeder, had plenty of rats. Her husband fell very ill, and I think his brother-in-law was ill as well, to the point where hospitalised, very ill with it. And they were all tested, and it was discovered they had this CO strain hantavirus. She was also tested, and she clearly had it and not noticed, as the majority of people do. But there was something about her husband that meant he was weak to it, and he was quite ill. He recovered, he's fine now. But that started out the UK government investigating this, and discovering that actually it was quite widespread. So it's one thing to kind of bear in mind. It is something that I'm sure kind of it's perfectly feasible that my rats here carry it today, and it's something that I need to be sensible around them. So it's like with anything, and I should say some of you will be kind of really worried at the moment because you've got an animal in your house that could carry something to pass to you that could make you ill, but actually basically every single animal that you come across has something like that. Dogs have them, cats have them, rabbits have things that they can pass on to humans, zoonotics, that can cause them to become ill, and it's something that you need to be sensible about. So I would not be letting a rat into my mouth. After I've handled the rats, I'll wash my hands. After I've cleaned out the rats, I'll wash my hands. It's all about a bit of common sense. If I had somebody that was immune suppressed and they wanted to visit the rats, then I would warn them, and it's ultimately their choice, but they're at higher risk. But if I did, I would warn them, and they'd definitely be washing their hands after they came out. In fact, I've got a sink in the rat room, which is very handy for that kind of thing. And it's the same, children you need to be particularly strict with, make sure they wash their hands, old people, etc. It's one that the vast majority of people are not going to have any issues with. You know, it's going to be something you don't even know that you've had. The majority of people that tested positive couldn't put the finger on a time when they actually recognised that they'd had this hantavirus. But for some people it makes them ill, and it does involve hospitalisation. So since then I know of another 2 people that have ended up in hospital with hantavirus. It was an very unpleasant experience for them. One of them no longer keeps rats, and I can kind of understand that because she didn't want to risk her family. The other one still does and is still breeding and is still doing an amazing job. And it's one of those, it has to be a personal choice. But I also don't want people going around thinking there's nothing we can catch from our rats, and there's nothing that we can give the rats, even though mostly it's staph and ringworm. Technically we can pass a version of strep onto the rats, I should mention that, but it's not the version of strep that makes us ill, so we're probably not going to know we have it if so. So for the rat's sake, also be sensible, and make sure you're not kind of like allowing them in your mouth where we carry a lot of kind of our bacteria and such. Make sure we're washing our hands before handling the rats and so on. Yeah, so I don't want anybody to panic about it, but I also don't want people to be unaware that there are risks in there. There's risks in everything in life, and I do think the rewards you get from rats way out that stat. But I will say, when the hantavirus thing first kicked off, I did have to ask myself some serious questions, because my husband could have been affected, etc. But I've kind of settled myself with it. I take sensible kind of precautions, common sense. What I will say is the government suggests that you can wear like dust masks when you're cleaning them out, or spray the stuff down so there's not a lot of dust kicked off. It's not something that I've gone to myself, but I know that if I was like advising somebody that was immune suppressed and wanted to keep rats, I would recommend that kind of thing. You know, you can do things, you kind of do risk assessment and decide what you want to do with that. So that's probably the main things. So of the zoonotics, don't worry about COVID-19 for the rat's sake. Worry about it for yourself if you're going to worry about it. And take sensible precautions with that, but you're not going to pass it on to your rats. Rats are a surface though, so in theory, if you have COVID-19, cough and sneeze over your rats and then hand your rats to somebody else, then there is risk, but obviously it will get washed off and cleaned off the rats eventually. In terms of stuff that we can pick up from our rats, Leptospirosis, not a big deal, very, very uncommon in pet rat population. If you've had a rat from the wild, make sure you treat it with a course of doxycycline, as well as other things you want to make sure you treat it with for parasites as well, just because if it's going near any other rats, it's safer. And do that before you put it with any of your other rats, because otherwise you could pass it on to them. Rat bite fever, again, very, very rare in kind of pet rats, not something, I think I've only ever actually heard of it in America and Germany. I've read about incidents happening from pet rats as opposed to wild rats. It is a risk with wild rats. Another reason why you want to keep your rats safe from wild rats, by the way, if they're in your rat room, you need to kind of make sure you're kind of humanely trapping them, releasing them, getting them well away and sealing up any place that they can get in there, because you don't want your rats picking up these kind of things and potentially passing them to you or other people. And then we've got Hantavirus, Seal Hantavirus, just to kind of double reinforce that one, which is a risk, and at least in the UK the majority of our rats will probably carry it, but it's something that you should just be sensible with and take precautions. Wash your hands after you've handled the rats or clean them out. If you're kind of immune suppressed, be a bit more careful, wear masks when you clean them out. You can change top levels of your clothes. You can have like a fleece, which is just for wearing in the rat room. Things like that are kind of sensible. Don't keep them, if you are immune suppressed, don't keep them in your bedroom, for instance. Keep them in a separate room where you're not having to go in all the time. Much like people manage with allergies, it can be done and you can do so safely. Of the stuff that we have to be, which if I'm honest is more common, we have to be very careful with, we don't want to pass it to our rats and we don't want to pick it up from our rats, is ringworm and staph. So I don't think I actually mentioned how to treat ringworm, but generally you need a fungal cream, antifungal cream, which you can pick up from the vets, and you do need to go to the vets for that. It's not something, in theory, dilute tea tree may affect it a bit and dilute hippie scrub may, but it's not particularly potent, and ringworm's a bit of a bastard, so you really want to kind of go and get some proper stuff. But yeah, both ringworm and staph we can pass to the rats and we can pick up from the rats. And then in theory, the one thing that we can't pass majority, like coughs, colds, flu, etc. to our rats, but there is a form of strep bacteria, streptococcal or something like that, crap at remembering full names, that we can pass on to the rats, but it's not the one that will give us sore throats, so it's highly unlikely we're going to see it. We just have to be sensible and not be letting rats in our mouths and up our noses, and even though they do try sometimes, just kind of discourage them, put them somewhere else, encourage them to play a different game. So that's it from me. What I'm going to try and do over the next few weeks, understanding that there's a lot of people that are basically confined to their homes with COVID-19 and potentially struggling to get hold of things for the rats. I would encourage people, if you've got anything that you are struggling, that you want to kind of like have an alternative to make do, let me know. I'm going to do the next one on probably dry mix, because I know that's something that some people in the UK are struggling to get hold of. Help you basically think about different ways that you can satisfy that in the rats for the short term, and even some kind of like longer term options if the kind of food we normally feed becomes difficult to get hold of. But if you've got anything else that you're particularly worried about, drop us a message and I will see what I can do. There's going to be limitations with what I can talk about, what I can kind of give you tips on. We can't replace all medical treatment, for instance, for our rats. The vets are very important, but where I can, I'll try and give you some kind of tips on what we can do, because we really need to hang on to what we can do at times like this, because there is a lot we can do and there's a lot we can't do, and we really need to focus on what we can do, because that will help us significantly. But I think it's over and out from me and Foo's little babies. Foo has made a horrible mess now, tipping up the water bowl, but quite enjoying herself, and Foo's little babies are also very happy. I don't know if I've actually introduced them before. They're 4 weeks old now and growing like little sprouts, little topazes and topaz dumbos, keeping me very busy. And also poor mum is fed up of them. So over and out from us, and I will see you next time.